So you've got yellow teeth and you want white teeth. Here's how we can get from this situation to this situation.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
The first step is figuring out why your teeth are yellow. Sometimes perfectly healthy teeth pick up stain over time, and even if you've got good oral home care, a lot of time yellow teeth can be unappealing, and patients are always interested in how they can make their smile look brighter and better. So here's what I recommend. The least invasive option is a good cleaning. If you haven't had your teeth cleaned in a long time, a lot of times a good dental cleaning by a qualified hygienist can remove a lot of built-up stain and plaque and discoloring agents that cause the teeth to appear yellow. If after the cleaning, the teeth aren't as white as we like, we do have bleaching options, and there are plenty of healthy, safe ways to kind of lighten up the outer structure of those teeth. Sometimes there are situations whether there's breakdown, old fillings, extreme deeply intrinsic discoloration from tetracycline staining or medication as a youth. Sometimes the amount of discoloration can be too much for bleaching. In that situation, we look at something like veneers or crowns to cover up the tooth and give it a more lifelike white appearance. In today's day and age, we get bombarded with products and home care remedies and lots of options for do-it-yourself bleaching kits. While some of them probably work just fine and are totally safe, my concern is if they haven't been vetted and properly tested by the dental industry, you can be putting really harmful substances in your mouth and actually doing damage to not only your teeth, but the gum tissue and adjacent structures in your mouth. We do have options that are take-home strips and bleaching trays, and if you're interested in bleaching, I would highly recommend you see a dental professional instead of trying to do it on your own, because a lot of times what's advertised as bleaching agents or good for your teeth hasn't been properly researched and vetted. You could be putting some really bad chemicals in your mouth and into your bloodstream and swallowing them. So that's not to say that all at-home bleaching options are negative or that they're going to cause you damage. I would just say be very careful in researching and making sure you've properly vetted the materials and the company that's providing those materials to you. And if you have any questions, any qualified dentist can give you great answers and kind of guide you in which products are better for your mouth. So let us know in the comments below, what's your biggest struggle with your teeth right now? Is it staining? Is it discoloration? Is it no teeth? Is it painful teeth? I would love to hear from you and see how we can help. I'm Dr. Brett Langston, prosthodontist and owner at Dental Implant and Aesthetic Specialist here in Brookhaven, Georgia, and I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.